Hello and welcome to the Croakey Health Media Weekly Update. I'm Dr. Ruth Armstrong, one of Croakey's editors, and today I'm speaking from Gadigal land in Sydney, where I acknowledge and pay respects to the elders past and present, and to all First Nations people who are watching this video, and whose nations this video and Croakey's content is touching. Our In Case You Missed It column this week reports that the World Health Assembly has endorsed the world's first pandemic agreement. Commenting on this development, United Nations Chief Antonio Guterres said that COVID-19 was a reminder that no one is safe until everyone is safe. This theme resonates across Croakey's stories this week, not the least in a reminder from Dr. Tilman Ruff that we're currently considered to be at the highest risk of nuclear war since the doomsday clock was established in 1947. Ruff writes that this issue too is on the agenda for the ongoing World Health Assembly. Our lead article highlights a statement from multiple health organisations in the United States warning that climate change puts everyone's health at risk regardless of where you live, and detailing some of the impacts we're already seeing. Residents in flooded New South Wales are currently experiencing climate impacts, including several deaths. And while Australian communities are rightly praised for their rescue efforts in these situations, we need to ensure that no one is left behind. We've published a statement from the First Peoples Disability Network calling on state agencies and emergency services to prioritise inclusive support for Indigenous people living with disability. The statement says that the same gaps in disaster response have been repeatedly identified: no clear evacuation plans for people with mobility restrictions, limited access to community centres, inaccessible information, and essential supplies not reaching those who need them most. 3 separate articles this week look at how we can avoid leaving people behind as we seek to redesign and refine our mental health services. There's a summary of a study that linked Medicare census and NDIS data to identify gaps in access for Aboriginal and Torres Strait Islander people, an article looking at how policy neglect has depleted the community mental health workforce, and another containing some expert advice in the form of a 5-point blueprint for a mental health system that is accessible, equitable and effective. Of course, there's plenty more up at Croakey this week. All our content is freely available at www.croakey.org, and we encourage you to share on social media or via email and subscribe to our weekly bulletin. Thanks for listening, and see you next time.